From family physician to state health commissioner to professor, my guest brings a wealth of knowledge and experience to her current focus, regenerative leadership. On this episode, we're discussing what regenerative leadership is and why it's important for public health, especially now. You're listening to the PHEC podcast, episode 420. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My guest shares her fascinating journey from family physician to state health commissioner to professor. She brings a wealth of knowledge and experience to her current focus, regenerative leadership. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to the community partners, as well as the broader communities they serve. The support we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us at our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes as well. I'm excited to introduce you to my guest on this episode. We served as keynote speakers in a slightly different format than you're likely used to in public health. It was leadership improvisation, where we demonstrated the skill of improv to deliver on the topic of leadership. We intentionally wanted people in the room to learn through the experience so that they could go back and begin to apply those skills. It is a fresh perspective for public health leaders. She and I reflected on our keynote experience and discuss it further in our conversation that you're about to hear on this episode today. So let me formally introduce her to you, and I'll connect our conversation. Dr. Marissa Levine is currently the managing director of Envision Wellbeing, LLC, whose focus is to facilitate the development of regenerative leaders needed to design communities where all can thrive. Dr. Levine recently retired from the University of South Florida, where she was professor of public health practice in the College of Public Health and collaborating faculty to the Department of Family Medicine and the Division of Infectious Diseases at USF's Morsani College of Medicine in Tampa, Florida. As a USF professor, she taught leadership to students and over 200 members of the Florida Department of Health workforce for the last 7 years. Dr. Levine trained as a family physician at the University of Virginia and then practiced the full scope of family practice in rural Pennsylvania before becoming a residency director also in Pennsylvania. In 2002, after completing her MPH at the Johns Hopkins Bloomberg School of Public Health, she brought her 16 years of medical practice experience into governmental public health roles at the Virginia Department of Health, when she started as the local health director for the Piedmont Health District. In 2005, she became the Henrico Health District Director and was then recruited to the central office in 2009, where she served as the Deputy Commissioner overseeing emergency preparedness and response. Dr. Levine spent a year as the Chief Deputy Commissioner before being appointed in 2014 as the State Health Commissioner, serving in that role until April of 2018. Let's connect my conversation with Dr. Levine right now. Hi, Marissa. Welcome to the podcast. How are you?
Oh, I'm great. Such an honor to be with you again.
Oh, this is fantastic. I'm excited. I know we were chatting a little bit before I hit record, and I thought we don't even need to like go over, rehearse anything or prep it because like that's just how we roll right now. So
We're
I,
improvising as we go, right? That's
that's
going to be
right.
the
That's
theme.
right. We had the opportunity to share the stage together. We were at the Florida Public Health Association, oh gosh, just a few weeks ago at
That's
the
right.
time of this recording. It was just wonderful opportunity I feel like we're fast friends. Like we met at that moment, but I feel like we've really escalated that. Like I've known you for a long time.
I think we're well connected more than we knew.
Yes, yes. I applaud the planners because I think they intuitively, had some insight. Like if we put these two together, like we're expecting things to really happen. So why don't you take a moment and just tell everyone a little bit about yourself, who you
Sure.
are, what you do?
Sure. I'm a family physician by training and have had really an amazing career that I never could have planned. So I'm very grateful for all the opportunities I had. But I started out in family practice in a rural setting in Pennsylvania. And that was after going through medical school in New York City, residency at the University of Virginia in Charlottesville, which was really a good opportunity to get kind of a more holistic approach. And I ended up in practice in Pennsylvania. I spent about 16 years in family medicine, and during that time got very involved in academic medicine too. I actually ran a residency program for about 10 years. And during that time, I was so enthralled with the community aspect of what we were doing because family medicine is really systems thinking. It's the individual and context of their family and community. And so I taught the community medicine part and was learning as I went about community. It was at a time where the healthy communities movement had launched. And it was before the traditional talk we have now of social determinants, but I was really interested in the contextual issues that helped people be healthy or actually move them toward disease, particularly chronic disease. And I just got so deeply involved in the community that I actually became part of the local board of public health at the local health department. It was a fascinating time. There's a lot of stories in there, but I'll just say that I ended up getting my MPH during that time when Hopkins started their first internet-based cohort. I wanted to learn about distance learning. They had the experience doing it. It was a tremendous experience. And I was able to get my MPH, but I did it part-time. And while I did it, and 9/11 happened, and I just had to find a way to give back. I'm from the New York City area, so it really hit me as much as it hit anybody else. And I ended up becoming a local health officer back in Virginia where I trained, and then had 16 years of public health experience. I thought I'd give 5 years of my life back, my service, but I loved it. I did it for 16 years, and it culminated as the state health commissioner in Virginia. And so since then, I felt I needed to give back to the next generation. I've been teaching leadership at the University of South Florida. Spent 7 years helping mostly the Florida Department of Health rising leaders, but then also some national work. And now I'm officially retired from all that, but I can't stop because the leadership piece, as you and I think we'll talk about, is so important right now. And there's so much opportunity. And I think I have something left to give. So thank you for the opportunity to continue to give.
Yeah, yeah. What a great introduction. And I admire your work. And yes, we are going to dive into that leadership piece. I'm really curious, and we're going to poke into part of this a little bit deeper. At what point do you remember a time or moment when you really started to think about public health as a pivotal part of maybe the first understanding of public health, or what made you decide to kind of lean into public health?
The experience of actually working at the community level and trying to appreciate what's the role of a physician, particularly a family physician in community. And what I realized was that the people who are providing expert information to the public on radio stations, writing in the paper at the time, were specialists, were subspecialists. And if you look at what they do, they take care of a very small population of people and they have a very narrow focus. So their context is really not the general public. And what I realized quickly was that the advice they were giving was not really relevant to the general situation of people. So in effect, you could steer people in the wrong direction by giving them advice about what to do, particularly interventions, when you're talking about a relatively healthy population. And so it really made me think a lot about, okay, what do we need to do from a prevention point of view, which is a key part of public health and family medicine? And what should physicians be doing in that realm? So I got connected, as I said, to the local health department. And what was really fascinating was that we had an immunization coalition, very active one, as there were, and hopefully still are to some degree around the country. And I got connected with a group of mothers who were very concerned about immunizations. And this was right at the beginning of the whole thing about autism. So Andrew Wakefield had just released his report in the Lancet, that flawed, tremendously impactful in a negative way report, that there was a connection, as he said, between autism and the MMR. I was practicing evidence-based medicine, so I actually reviewed that report, and then I met with mothers from the community, and I went through the report with them. I said, there's a problem with this report. And it was even before Lancet came out and identified all of the evil things that Andrew Wakefield had done. But the report made this jump in conclusions that were not supported by the evidence that he provided. It turns out the evidence he provided was not only inappropriate, but it was false. He had done that intentionally. But it was clear to me reading the article that you couldn't make that conclusion from what he provided. And I was desperately trying to help them see that. You see, Andrew Wakefield had come to our community by their invitation. And so myself and folks from the health department went and heard him. We heard him speak. And then I sat down with these community members, and I realized that there was something very powerful that we need to be careful of. When you give people information about something that they want to latch onto. Okay, so for a parent with autism, if you tell them something about what causes autism and it resonates with them, it's really hard to undo that. And so I think that really got me thinking about public health's role to communicate effectively with people, provide trusted information, to do it in a manner that they can connect with and value, and that we have to be really good about helping people fend off mis and disinformation. So I learned really early that there was this critical role, and this public health entity that I was starting to learn about was absolutely important, but not terribly well valued. And, not a lot has changed.
Yeah. Yes. I wish we had met years ago. There's a lot, we can't go back and change anything, but there's still
We can learn
a lot
it.
that we can do.
Yeah.
We can definitely learn from it. And there's a lot that we can do now. I think that's really positions well for where I want to kind of really go with this conversation today. Let's talk a little bit about what you're doing now at this retirement phase, but not ready to sit down. I like that. I'll be like that too. I don't know if I'll even refer to it as a retirement phase. I think it'll just blend.
I will tell you one piece of advice is don't refer to it as retired, because then people think that they can't call on you. And, I want to do this at my own pace, which I think is what this phase of my life affords. But many people kind of just write you off when you're retired. And it's a shame. I think there's a lot of value to add still, at least as long as I think there's value, I'll be there. So.
Yeah. Well, I'd like for you to just talk a little bit about what you're doing now, but let's kind of also fill in some gaps there. We started out alluding to our speaking together, this improv approach in leadership, but talk about what you're doing now and describe that leadership style.
Sure. It's interesting because what I'm doing now has built up over the years based on all these experiences. In the time that I mentioned about the vaccine issues, I also connected with this national group of healthcare leaders who were trying to figure out how this new complexity science, which was new at the time, could inform what we were doing. Because we realized we were in a very complex environment. All of us had some managerial and leadership roles. And the MBA approaches just didn't work. They didn't make any sense. It was very complex, sometimes chaotic. And so we were learning together about that. And that was my first introduction to formal systems thinking and complexity, which has really informed my decisions, my actions. And so I really took off on this systems thinking concept. And so I think part of the reason I went into public health is because I realized as a family doctor, I could only do so much with and for my patients. There were so many other contextual influences, right? We know that now. And so it seemed to me that public health was a way to do that. At the time, I didn't appreciate the really significant impact of the policy part, but I was involved in policy to a limited degree and had my first taste of it. So getting into local public health, this now was right after 9/11 and the anthrax attacks. I was a rural health officer, and I really felt like we had to bridge the public health and the clinical practice aspects. And I was well positioned to do that, having just come from practice. And so I realized that you have to personally connect with the medical community and the hospital system, which I did. And then you have to have feedback loops. You have to provide information back to them. I think this is really important for your audience. We ask for a lot of data from public health from people. Do we give it back in a way that's useful? And so what we did was we had the reportable disease list, and we made sure that, we knew who was providing it, how they were giving it. But then we produced a summary report back in a useful format for the practitioners. And you know what? Our reporting increased. Imagine that.
Yes,
So
exactly.
all of that just led me to realize how important leadership was. And I think I continued to evolve my leadership. And then, of course, I was in the state office, and the policy piece became huge. And as state health commissioner, you really appreciate what it means to lead. It's very humbling. It requires all of your energies. There's self-sacrifice to a degree, but you also have to do a lot of self-care, right? Because it wears on you. So all of those 16 years of public health kind of led me to appreciate an appreciative and a strength-based approach to leadership, particularly in public health. And I had learned about appreciative inquiry when I was in my community work in Pennsylvania. I also was introduced to asset-based community development, John McKnight's work. And those two things helped me realize that we have to take an asset or a strength orientation to our leadership. We have to take a growth mindset. We can do it, have a can-do attitude. There are a lot of stories behind that too. And we have to also be humble because the leader doesn't have all the answers, shouldn't pretend to have all the answers. And we really need all the brain power in our teams, in our collaborative. So it really helped me appreciate the collaborative piece. So when I went to USF, they had a dormant center for leadership in public health practice because they lost funding. And it just turned out the dean, the state surgeon general at the time in Florida, myself, and another faculty wanted to resurrect this. Perfect timing. I said, I want to do that. I want to help the next generation of leaders lead. And I wanted to apply what I knew and then keep learning. So it was a wonderful opportunity for 7 years to continue to grow, understand, and evolve the thinking about what leadership should be. And, it has to adapt to the context. That's a critical part. And so we had a great experience doing that. And in that time, I deepened my understanding of complex systems. I appreciated that we're not talking about these mechanical things. We're talking about living systems. We are individually, collectively living systems embedded in larger systems, the ecosystem, and we're all interdependent. And so we have to appreciate what that means from a leadership point of view. So it evolved to this concept of regenerative leadership, not a term I made up. And I was just thinking, this makes so much sense for the public health arena because we're all about health and well-being and prevention. And we should be thinking about the answer to the question, what are the conditions in which living systems thrive? Beings like us, right? Communities, seeing organizations as living systems and appreciating the interaction with the larger ecosystem. And how do we make better what are called life-affirming decisions? So that's where it's gotten to me now. And my goal right now is to help people kind of rethink contextually what it means to be a leader now and to build the collaborative leadership that we need for these really complex issues in the complex times. And I think that the regenerative approach really resonates with people when they understand it. And we really have to help people unthink what they've learned. We've learned that we're just cogs in the wheel of big machines, and that if we just work harder, things will turn out. Doesn't matter if we kill ourselves in the process. That's not how it works. And that's not what we need right now. And if we didn't learn anything from COVID and from everything that's transpired recently politically, we have to get really serious about self-care, relationships as being important, and that leadership should be promoting those conditions and really understanding what they are. So that's where I am right now.
Absolutely on the same page. And thank you for the explanation, like the journey really bringing us here. So when we talk about regenerative leadership, what does that mean?
So it's great. Imagine that you're in a forest, right? And that you're looking around at the forest and asking the question, how does this forest thrive? Well, it's not because one tree is doing whatever it does to thrive. It's because there's this amazing connection, this network in the soil, in the air, and there's a sensing that goes on. Trees can actually sense what's going on around them with other trees. The soil is alive with nutrients. It's its own incredible living system. And we can learn from nature how to thrive like nature and to create communities that thrive, natural ecosystems where we and the ecosystem thrive. And the leadership necessary is regenerative to the individual, to the collaborative, and to the larger system. So in a nutshell, it's really about stepping back, taking a perspective of connection and making better decisions that positively impact the whole system. But first, you have to appreciate that there is a system, and nature can teach us because nature's figured out sustainability over millennia. We haven't been here that long. We can learn a lot. And I'll just say that indigenous communities really understood this better than us. So I'm trying to learn more from that indigenous wisdom. And we now can think about how to apply it in the current context. Now we have technology, so technology can be an ally, but there's incredible lessons there. We have to be open to that. And that's where the humility comes in. So that's what regenerative leadership is a large nutshell. And I think I'll just say that ultimately we're seeking better harmony between the components of the system so that the thriving is more equitable. And, right now, the famous phrase, the system is perfectly designed for the results that it causes, we can say in public health, our communities are doing just that, but it's producing inequitable health outcomes. Therefore, this is not the system we want. We can design a better system.
So how would, let's say there's so many parts, like where do we even start? If we want to look at public health moving forward and leadership and really embracing a different style of leadership, where would be the best places to start? Would it be within government structures? Because, every county, city, state has a different system, not to mention, country to country, but where would be a great place to start?
Like anything else, it's where people are open to trial. I think when we find individuals, organizations really set in their ways, it's hard to make those changes. But right now, the great opportunity, despite all the chaos, is there is interest in doing things differently. So we have to have some trials here and get past the fear of failure. It could be anywhere. I think for individual listeners, I'd say it starts with us each individually, internally, because there's important inner work to be done first. And we talked a little bit about it. The inner work is about self-respect. And with self-respect comes self-care, self-awareness, that emotional intelligence piece, all things that you can enhance and improve. It's hard to go into the relationships we need if there isn't a strong foundation of authenticity, of self-care and self-respect, and that emotional intelligence. You need that then to create these generative relationships that are absolutely critical to the regenerative process. We're social beings. I mean, we don't often want to believe that, but our health and well-being is totally dependent upon social support, social structure, and social connections. So the question each of us can ask is, what do we need to do to enhance our well-being and to be the part of the relationship that's needed? You can't control what happens on the other side of the relationship, but you can go into those relationships being the best that you can be for that relationship and for yourself. Every relationship changes us. If we can go in with that positive, respectful perspective, we might have an impact and then we might benefit from it. But it's not just about benefiting ourselves. It's really about spreading a field of positivity, if you will. And it's not an ignorant positivity. It's being fully aware of the challenges we have. But the other thing I love about the regenerative concept is that you appreciate that in nature, living systems are always stressed by something. And that's the only thing that makes us better. I hate to say it, but that song, if it doesn't kill us, makes it stronger. So we shouldn't be afraid of the stresses, of the threats. We should embrace them as opportunities. And that's what allows us to regenerate, to be better. Because regeneration really is about being better as a result of the stresses, the threats, the hazards that come at us. And that's very true in nature. That's a really important nature lesson. So it starts with each of us. And I would say we can focus on the inner work we need to do. And sometimes we can't do it alone. So you partner up with people who you're comfortable with, who you respect enough that they can challenge your assumptions, beliefs, and biases and help you to grow. And being open to that is really what being humble is all about.
So this is perfect, kind of leading up to our time in Florida.
Yes.
Because, I guess to put in context, the Florida Public Health Association's annual meeting, they had their fair share of challenges leading up to the very last minute where their governor, I guess, had decided that the employees within the Department of Health could not attend the conference. There was a lot of conflict. They weren't sure if they were going to still have it or not, but they decided to continue. So it was a reduced crowd. And I guess the employees could come, but they had to use they couldn't represent the state. So there was just a lot of political pressure. So the people that showed up, I felt like were the people who were hungry for some change. They wanted, they were choosing to continue in this work because it was probably easier to do almost anything else other than continue with public health work at that place and time. And I remember, I think I shared this with you, like I was a little intrigued and excited to show up for them because the people in the room I felt were really hungry and ready for something. And I wanted to make sure that they, not only it wasn't just like a pep rally, we, pump them up and then send them off, but I wanted them to leave feeling like they had something actionable that they could put into place and something they could do that would be different. So, of course, we were able to demonstrate, a lot of what you're talking about right now. Like it starts with the individual person. We demonstrated, how they could do this and kind of look introspectively without even, really preparing in detail, using the art of improv. So I want to let you kind of talk a little bit about that experience because I think there's some good takeaways for people listening who may want to, incorporate some of this themselves right now.
Yeah, thank you. And, the regenerative leadership part of this is all about building your adaptive capacity individually and collectively. I think that's a real opportunity for public health. So you have to appreciate that the context is always changing, sometimes more rapidly than others. And what we were trying to role model there was that we wanted to adapt in real time to one another. We had never been on the stage before. We knew kind of where we wanted to go, but we wanted to use the tools of improv to do that adaptation. And I think this is a really important lesson for public health people. We can't be rigidly following plans and expect a certain outcome. We have to appreciate that because the context is changing or it's different in different places, we're going to have to take different approaches, but we might not know what that approach is. So we have to be open to adapting and we have to create a space in which we can adapt. That's what you and I tried to do, is create a space. So we tried to use some of the improv tools where we don't block one another's thoughts and ideas, which unfortunately we're really too good at in the organization because of the hierarchy, right? If it doesn't come from the top, it can't be a good idea. Or, we've always done it that way, all kinds of things. We've got great ways to block ideas. You and I were trying to build on one another's ideas, and it was a simple improv concept where whatever you say, I would say yes, and so I would build on it. And, if we were doing it more deeply, we might summarize what we heard, because deep listening is an important part of being able to improvise and adapt, and to also respect the other person. Feeding back what you heard helps them then correct it if it was mistaken in any way, but it acknowledges you're actually listening. So it means that you were present, which is the other critical thing. So that was so fun. And I think we just did that very naturally. It flowed. It's a practice and a skill I would encourage all of your listeners to work on, and particularly if you're in a supervisory role, because we're really good at saying no.
Yeah.
And, it's not respectful, but it also doesn't build trust, is the foundation. And from trust, then you can actually put all kinds of different perspectives and ideas on the table and hash them out. That's the conflict of ideas that we need, not the interpersonal conflict, which gets in the way. So yes, and that really positive approach builds trust and allows for the deeper conversation about different perspectives and ideas, because you and I don't know which one's going to work. And we have to hash it out and figure out what to try. But then we have to come back in an iterative fashion and say, how well did it work and what kind of course corrections we need to make? So the important thing in public health is this is going to be never ending. We're iteratively going to continue to have to learn about what we did, adapt and act, and then iteratively learn and act all over again. And that's why collaborative approach is so important, and why we need a collaborative leadership approach that values us as living beings. So thank you for the opportunity to do that. It was fantastic. And I was so glad to be there, just like you.
Yeah, that was wonderful. And I think that it's something that it's simple, just as simple as practicing, pausing, listening, then, the yes and. And I like that. And if you want to incorporate that deeper, recap what you heard for that deeper connection, what we experienced and what we demonstrated was really powerful for people in the room. It was exciting to hear and watch what emerged. It was exciting to just be participating and, getting to hear from you and building on that. But I think it's something that you can incorporate right now as students.
Absolutely.
Can practice this in the classroom or outside of the classroom, coworkers, this concept. I think where we are in public health, leaders, supervisors, managers, department heads, this is a critical time when we need to do something different. And so if you're open and you're looking for a different approach, this is a great starting point, because it allows people to be heard. I worked in state government for a period of time, and I know very well the shutdown,
Yeah.
the way that we've always done things. So practicing this in whatever setting you're free to do so is an incredible way to be open to what you don't even realize is around what could come from your colleague.
And I would say we have to appreciate that public health, governmental public health, is very hierarchical, by design. It's part of governments. Hierarchies are limiting by design. And so they're not really our friend to being flexible, adaptable, nimble, agile, as the term is now. And so how do we demonstrate agility in hierarchical systems? Well, the critical thing is that we still need that entrepreneurial spirit. And so we have to make sure we connect across the sectors, across the silos. We're really good at siloing, and funding has siloed us too. But we still, if we appreciate that we're a living entity, we're living beings, we can connect across those silos in a respectful and a deep way. And you do that through some of these skills we talked about. So I think these skills are important to make sure that our hierarchical organizations can still adapt and be agile, because we absolutely need to be. And hopefully we'll create the kind of hierarchical leaders or people in leadership positions in hierarchies who know that that has to happen. So they actually support it, or at the very least get out of the way to let it happen. And unfortunately, if they don't, it still happens in the shadows of the organization, but it causes all kinds of negative results. We're talking about creating positive environments where that's supported. And, business has already figured this out. That's what agile organizations are out. They're about networked entities, because here's another lesson from nature. Every living entity is networked, functionally or structurally. So we have to really be good at building networks in our organizations. And then we have to, I think where public health needs to go is networking better in community and in a more deep, meaningful manner that relates to people where they're at. So that's a whole nother topic. But from an organizational point of view, this is absolutely critical. And yes, people can start practicing those skills now. Whatever their sphere of influence is, they can make change. And that's where they should work.
I so enjoy this conversation, and I know we could continue. I want to be cognizant of time. So I know that I sense we're going to have you back in the future for another round, another conversation.
I think there's more to talk about. Yeah.
Yes, there definitely is. I know that our audience is very diverse. We have a variety of leaders from different aspects and different sectors of government. If there's leaders, organizations that are thinking, oh, we need to talk to her, maybe have her come in and help us. Can you just briefly kind of describe how you can help organizations? Yeah.
Yeah, no, I've been very involved in leadership development, mostly as groups in the public health space. We've done some work with public health and their community partners coming together and learning together, because I think that's a critical opportunity. So from an organizational point of view, I'm happy to work with you for leadership development to help you think differently, think in living systems, move toward the regenerative concepts, and understanding, as I like to say, how to build your regenerative muscle. I think that's an important piece of this. So I can do that with organizations. I can do that with groups. I think it really works well when a team of people who have to work together come together and we do it in person, because a lot of this really benefits from in-person training. But I would encourage people too, if you're working with the community partners, that might be another opportunity for me to help you build that regenerative approach. It's not rocket science, but it does require a shift in mindset and an openness, and really focusing on building that trust between people by deeper understanding and being more fully present. So I'm happy to do that. I do have a website, envisionwellbeing.org, which is where I would encourage people to look and see. And I think there'll be more opportunities coming, because I'm continually seeking out how to make this as practical as possible. So it's not just some theoretical construct, but just like what we did with the improv. What is it that you can actually do and improve yourself? But I think more importantly, we have to do this for public health, because it's about public health becoming more effective in the current context.
Yeah, that's wonderful. And we do have the links to your website and also links to connect with you on LinkedIn. So I'll make sure that all of that's included in the show notes so that our listeners can easily find you. Marissa, this was fantastic. Thank you for making time and coming back on the podcast to chat with us and to just share your vision and even sharing some really actionable steps and explaining on this episode. I think it's great. Our listeners can walk away, with something that they can start to practice and do and incorporate right where they are. So I appreciate you.
Well, I'm so glad we got to improv again. And thank you so much for the opportunity. What an honor to get to know you even more. And I'm so glad our paths crossed. And I do hope we get to do more.
Absolutely. I really hope you enjoyed that conversation as much as we did. I look forward to keeping in touch with Dr. Levine and having her back on the podcast again in the future. I'm especially excited for the possibility of sharing the stage with her again in the future for more leadership improv sessions, as there is so much to talk about and so much work to be done. Let's remember what we've learned from Dr. Levine about regenerative leadership as we all continue to navigate this complicated political climate that is impacting us all. I encourage you to connect with her and learn more about the work that she's doing. When you reach out to Dr. Levine, be sure to let her know that you heard her episode on this podcast. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 420, can be found at phecpodcast.com. Once you're there, just navigate to episode 420 to find the show notes. One more thing before we go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals around the world. You can download our new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.